Yeah, everyone, Nunami here. In 2022, I was asked to travel across Lutruwita and record our community's stories of quitting smoking. I heard so many great success stories of our people who managed to quit and got a good picture of why our people chose to quit, how they did it, and what supports they were able to access along the way. This is the Makara Patapa podcast. Hi, Dr. Chris. Thanks for meeting me today. How are you?
Hey, Nunami, thanks for having me on. Yeah, pretty good. Thank you.
Did you want to introduce yourself or your role here at the Health Service?
A new GP registrar at the Health Service in Hobart. So I'm here since August. I'm going to be here for the full year up until next July as well. I know from meeting the Aboriginal community here that 40 to 50% of Aboriginal people in Tasmania smoke. It's one of the biggest things that we deal with here.
Which age groups are the highest rates of smoking?
18 to 30-year-old, and then 30 to 40 would be the highest, yeah. So you can come at any time and speak to us. So we've got nurses and doctors here 5 days a week. We also have Jay, who I think you're going to speak to, who's a quit worker, and we also have counselling as well. Any conversation you want to start off with, you can always come and chat to one of the GPs or the nurses here. Yeah, we're a team, so the nurses work with me, and then I can refer people to Jay. And then I generally like to have people come back and see how they're going after a few weeks if we do initiate some treatment. Nicotine is one of the most addictive substances in the world. In the media, as anybody who's ever watched a movie will see people smoking, or any TV show, people are smoking. And through the last 150 years since it was kind of really discovered in Western civilization, people have been smoking for years and years and years in South America, but it's just when it's gotten manufactured into cigarettes in the 20th century, that's when it exploded. Why is it addictive? Is the nicotine is the thing, but everybody's a little bit different in terms of how they respond to nicotine. Some people become addicted really easily, some people don't. And there's lots of other reasons, especially in the Aboriginal community, why people will smoke. One is stress. People who are under lots of stress and have mental health problems tend to have much higher rates of smoking. And we know that in the Aboriginal community, due to the effects of colonisation, there's a intergenerational stress, which is a big part of it. Another thing is, people who are in the kind of more lower socioeconomic groups, so basically people who maybe not have as much work as other people, or might not have made it all the way through school, tend to have higher rates of smoking, which also affects the Aboriginal community here and on the mainland as well. Yeah, lots of different reasons why people get addicted, but the main thing is the nicotine. That's what we as doctors and nurses and medical staff can help with. So nicotine is the substance that causes you to be less stressed. So that's another big reason why people get addicted to it. It's I'm feeling worked up, I have a cigarette, and kind of lowers the mood or dampens it down a bit. Like Valium and those kind of things do. They're also things that suppress your stress, but they're also highly addictive. A lot of people find when they start smoking that, I just had one or two, and then, it feels good. You get the buzz from it. You get lightheaded, or maybe you get a little bit of, you're more relaxed, you're more chatty, you might be out with friends, and then that just becomes I'll go out for another one, and then you come into a cycle. And what the sign of addiction is when you actually need it to feel normal. So you have so much nicotine in your system all the time, but your body gets used to that. So now you need to put the nicotine in there to feel back to where you were. And then that causes you to need more and more and more nicotine. So you increase your cigarettes as you go. If you stop smoking straight away, right? The nicotine will be out of your system within 5 days. But that doesn't mean that the cravings go away after 5 days. So all those symptoms that you talked about, feeling either more hungry or not wanting to eat at all, or feeling anxious, feeling tremulous, feeling kind of worked up and panicky. These are all really common after you stop nicotine, because you've been so addicted to it, you've been using nicotine to feel normal. Mm-hmm. And so that's what we would use nicotine replacement for, to help reduce those symptoms. After 5 days, then if going cold turkey, then the nicotine's out of your system. And then all those other things that have been suppressed by the cigarettes, so your sense of smell and taste will come back in a week when you stop. Your skin improves after about a month when you stop smoking cigarettes. Your lungs, which have a system to naturally clean themselves, that comes back to life after about 2 or 3 months, and then your lungs start to clean themselves and get rid of all the tar that you've been putting in. We like to help or give people the option of having different medications or patches or inhalers to help reduce it for each individual person. So that's why coming in, having a chat with myself or one of the other GPs or Jay can be a good start. Everybody's a bit different, because cravings are like psychological as well as the physical. Some people, keep using nicotine replacement for months and months and months and years, just to stay on top of it. If you quit smoking but you fall off the wagon and you go smoke again, that's not to say, that's actually a positive sign for us that you tried once before. And trying again can be it can be more positive when you try it second and the third time. So don't be afraid to come back. If you've failed once, we can try again. But the risk of cancer causes 16 different cancers, from lung cancer, number 1, to breast cancer increases your risk of bladder cancer, skin cancer, all of these ones. More likely to get chest infections. It causes you more likely to have problems with your lungs in the long term, like COPD or emphysema, which is the old word for it. It can make your asthma worse, it can make your skin worse, it can, I think a lot of people know how bad it is, but to reinforce that for people is one of the big things. Parents who smoke, they're more likely to start to think about quitting because of the effects it can have on kids, like causing kids to, their asthma to get worse or to, be more likely to get chest infections when they're younger. There are all things that even, if you smoke outside, you still have the smoke on your clothes when you're holding your kids. The most common way people quit is just by going cold turkey. Really good option, and then we can help with that too. Cool. But nicotine replacement is, in terms of, the feeling of anxiousness, the tremors, the sweats, all that sort of stuff, the appetite changes. We can give you nicotine really safely through a patch or through an inhaler or through gum rather than through the form of cigarettes, because it's all the other 7,000 chemicals in the cigarette that cause all the problems like the cancers and the lung disease and everything like that. So we can give nicotine really safely and it's absorbed through the skin really, really easily. So patches are really good. What I like to do is give a patch and then which stays on for 18 hours or 24 hours, and then you put a new one on the next day. And then when you've got a craving, you can take a inhaler or use a lozenge or use gum, and that kind of takes away the peak craving and kind of generally makes it easier for people. And then the other options are the pharmaceutical, like the tablets. At the moment, we've only got one available, which is bupropion, which is Zyban. So Champix is the one that's the most effective way of quitting. Zyban's slightly less effective, but still much better than doing nothing or taking, placebo. Zyban is like an antidepressant. So if you've got some people find, that their mood improves quite a lot while they're taking it as well. And, I've definitely used it in people who have like say a bit of anxiety or like mild depression and are also smoking, and then they can kill 2 birds with 1 stone in theory. So at the moment we just have Zyban. Champix is really, really good when it can be given safely. So once we got a supply back, there's 2 good options. But yes, Zyban most commonly can affect your dreams. So people get kind of pretty intense dreams in it. But Champix can definitely affect people's mood. Sometimes it causes them to go pretty high or, causes them to be much lower, kind of cause depression. And in that case then, we tend to follow people up really closely when we start medications, so we try to catch that early if that does happen. It wouldn't be great from our point of view if we just let people go and then didn't see them again and then they're all either suffering or while on this new tablet. We're here anytime you want to call us about anything. Yeah, because there's lots of different options that we can try and we can try different combinations. And as I said, everybody's slightly different. So yeah, we're very happy to hear from you if you're having any problems with anything that we're doing, because it's a team. Like, we can only work with you if you want to work with us. And if you have a bad experience with us, it's better that, or with a bad experience with medication, it's better that you tell us so that we know in future, or we can change it.
What are the benefits when people finally do quit smoking?
Sure. Oh, Number one would be, say if you've got young kids, that you're not exposing them to passive smoking. Number two, apart from the health benefits, would be, your lungs coming back to cleaning themselves, your sense of taste and smell coming back to normal. Your risk of heart attack reduces, even after one day. Your risk of developing cancer reduces, and I think by the time you've quit for 10 years, your risk of having a heart attack is back to what if you'd never smoked before.
Wow.
Yeah. And one of the big things I wanted to mention would be the financial, because say if you smoke 20 a day for a year, that's $11,000. Can you imagine if you'd spent $11,000 for 10 years, you're now 100 grand richer. So yeah, if anybody in the community wants to come and chat to me or anybody else in the team, feel free anytime.
Yeah, everyone, Nunami again. Thanks for listening to the Makara Patapa podcast, a podcast series by the Tasmania Aboriginal Centre with support from Public Health Services Tasmania.